Have you heard about the landmark study called the Winsor autopsies, how an MD discovered chiropractic? Well, if you haven't, stay tuned to this message that we're going to give you on our continuing series on what type of care is right for you. Good afternoon, Dr. Allan McCord here at Kenty's Chiropractic, and today we're going to talk about this landmark study that was performed in November of 1921 by a gentleman by the name of Henry Winsor. And the title of the research article was called The Evidence of Association of the Dissected Cadavers of Visceral Disease and How It Correlates with Vertebral Dysfunction of the Same Sympathetic Nerve Segment. And basically what he was interested in, as a medical doctor, he was seeing patients that were coming to him that had been dramatically impacted in their health by chiropractic care. And in talking to the chiropractors, they explained anatomy and physiology. And I have a poster up here that actually shows and reveals what's called the autonomic nerve system. And in this diagram, you see all the organs of the body, the internal organs, what's called the viscera. That's why the title included the name visceral. And then the correlation of the nerves to the spine. And so this was a study that was actually granted and permitted by the University of Pennsylvania. And so what he did is he took 75 human cadavers, cadaver is a dead person, and 25 cat cadavers, 25 cats that had passed away. And what he did was he researched, dissected them out, and he looked for a failed organ within that dead body. And then what they did is they traced the nerves from the failed organ back to the spine to see if there was a direct correlation. And really, really profound findings that he found was that out of 221 total structures, so out of these 100 specimens that he did this research on, there were 221 diseased or failed organs that they found. When they traced them back, there was 212. So out of 221, there were 212 actual segments that were affected that led possibly to the dysfunction of that organ. So that's almost like 100% correlation between minor curves or a shift of the vertebra and diseases of internal organs. And that relates really, really intently to you and your overall health, because you want to be the healthiest, you want to be the best, you want to have optimal health through your 80s, 90s, and 100s. And how we do that chiropractically is we find and identify these minor curvatures that Dr. Winsor talked about. What we term in chiropractic is called a vertebral subluxation. And then we apply forces to actually adjust the vertebra, move it back into its proper position, and actually can bring healing to that. And I love this simple little poster that we show all the time to our practice members here. It's titled, Do You Understand the Damaging Effects of Subluxation? And in this poster, you'll see a picture of the brain here with the spinal cord. The blue segments are the vertebra. And you see the purple line here going to a cell, which is healthy. And so there's a communication that occurs between the brain and the body. We call it the brain-body connection. And down here, you can see that this vertebra is displaced. This would be a minor curvature, or what we term in chiropractic, a subluxation, and how that tissue is not well. It's actually what we call dis-eased. It's not working at its optimum, and how that can then lead to symptoms and eventual disease and overcoming of an organ, which could lead to death. And so I find this really, really relevant to our patients to be able to help them identify that if they have this, and interestingly, you can't feel it. The only way you really know whether you have a subluxation is if you're checked by a chiropractor. And that's what we do right here at Kenty's Chiropractic. So hopefully this segment here we've done on the Winsor autopsies will reveal more about how chiropractic care can actually help and enhance your overall health, helping you again to live healthier into your 80s, 90s, and 100s. Make sure you check back and check all of our entire series on what care is right for you. Glad you could join us. Thanks for coming and attending today. Thank you.